Hi there. So there's 3 patients here, and we're going to give our individual stories about our stories from diagnosis. There was going to be 5 of us, but one of them is sick, and the other one is stuck in Tenerife, thanks to Thomas Cook. So there's 3 of us, and hopefully you'll find our stories interesting, and they're very different, and you might find that some of the things we say resonate with you, and we might just have an open conversation afterwards. So please feel free at the end to just talk about your stories. And how many patients did you say are here today? Can you put your hands up if you're a patient? 1, 2, 3, 4, 5, 6. Not many. Okay, so I'll go first. And this is Bal, and this is Andy. And here we go. So I come from the southeast in Essex. So we drove up yesterday, and the sat-nav said it was 7.5 hours, but Glasgow kept moving, so it took us 12 hours to get here. I was diagnosed in December 2015. I presented with headaches. My blood pressure was 220 over, 180 over 2, what is it? 180 over 80. So it was 220 over 120, which is quite high. And I had a couple of GPs come into the room, and they gave me beta blockers before I even left the GPs, and said, we'll refer you to the nephrologist, because, well, actually I had blood tests, and then they saw that there was a problem with the kidneys, and then they said they'd refer me to the nephrologist. For me, that was the worst period, because I had to wait 3 months to see the nephrologist. I knew there was a problem with my kidneys. I knew my blood pressure was high, but really I felt I was left a little bit in limbo, because I didn't know what the future was all about. I was under Southend Hospital, a guy called Patrick Harnett, who was fantastic for me. He was very laid back, very calm, and he said that after a few months of seeing him, I saw him every 3 months originally. He said that just get on with your life, put this to the back of your mind and live a normal life. My EGFR at the beginning was about 29%. And I had patient view, which Jonathan talked about, and seeing him every 3 months, I felt sort of I was in good hands, really. Since 2015, I was losing about 1% a year. So about 6 months ago, I was around 25%. Well, there's a story to come. I take an ACE inhibitor and a blood pressure tablet. I take a fish oil tablet because I read somewhere that might be good, so I thought I'll stick it in the mix. I've tried to get onto 2 different trials, both of which Chike mentioned. The one was fostamatinib, which was done by a guy called Fred Tam in London. But my kidneys were actually too good for the screening, so I didn't manage to get onto that one. I then decided I was involved with Jonathan in Manchester recently with some Americans that are running the Protect trial that Chike talked about, and I thought, I'd quite like to get onto that. So I went to Guy's Hospital, where I recently did the screening for the Protect trial. The criteria was a 30% kidney function with a minimum of 1.5 grams of protein leakage. And as you know, I was on about 24-25 EGFR, and I was thinking, right, how do I get from 24-25 to 30% in order to get onto the trial? Somebody told me that I could try a vegetarian diet, and I thought, anything's worth a try. So I drank loads of water, and I went on a vegetarian diet, and my last reading was 33% from 24-25. Might be unique to me, might just be a random thing, and in a few months' time it goes back down again. But my personal story is I feel great, and the vegetarian diet has really been good. So I wonder whether the EGFR is a measure of your protein-creatinine ratio. So by eating a vegetarian diet, I'm reducing the amount of protein I'm eating, and by drinking loads of water, I'm diluting the creatinine. So that's probably why my EGFR has changed. But the disaster is that I got 33%, so that was like, well, hey, I'm on the trial. But because of the vegetarian diet, my protein leak had gone from 1.8 grams down to 0.4 grams. So I'm not on the trial, but actually, on balance, my kidneys are healthier because I'm not leaking as much protein, so I'm smiling still. So is there any bad things to say? My personal story is that I do get really tired, so sometimes I could crawl into bed at 6 o'clock, absolutely shattered. I have some joint pains occasionally, but is that just getting older? I don't know. But generally, I just live a very normal life. I enjoy every minute of it. I've got 2 children, and yeah, that's my story so far. Over to Val.
Hi, my name's Val. This problem was picked up when I was pregnant with my last child, who's 17, so 18 years ago. So just went for my 6 weekly checkup when you find out you're pregnant, and my blood pressure was extremely high, was quite sky high. So to go back into the waiting room, done that a couple of times, still sky high. And then she was really quite concerned. So she said, right, you need to go to the early pregnancy unit. I goes, what, no? She goes, yeah, no. So I went to the early pregnancy unit. He was fine, checked into the internal scan. He was absolutely fine. So throughout the pregnancy, the blood, they gave me Atenolol. So that lowered the blood pressure. Then towards the end, for the last sort of 6 weeks of my pregnancy, they had to go in and get a scan done just because they were concerned. They said he was smaller than my other 2 boys. But also because I had like protein leakage in my urine, and then high blood pressure mimicked preeclampsia. So because of that, they were concerned I might have preeclampsia because of the same symptoms, and he was induced about 2 weeks early. So he came out, he was absolutely fine, and then it was needed to find out why you've got this protein and high blood pressure. So after about 3 months of testing, they diagnosed kidney disease. So initially, when it was about 34%, and this was like 17 years ago. So throughout the years, it has come down, the kidney function. It's down to, I think, 17% now. So that's about it, really. It's been a bit of a journey. So this year, last year I had a hysterectomy. It was sitting at 27% last year, my kidney function. And when the consultants were saying you need to have this operation, I was a bit reluctant because to me it was my kidney function going to drop, and I didn't want to have it because of that. So they took, so before the operation, a day after, they took my kidney function, everything was fine, and I thought, great, I've dodged a bullet. And even 2 months after the operation, last August, the kidney function was still sitting at 27%, and I thought, great, I've dodged a bullet here. At the beginning of this year, I was feeling good, had recovered from the hysterectomy, I joined Slimming World, joined the gym, and I was feeling good. I thought, this is really good, and this year is going to be a really good year. And then in February, went to the just to get my kidney function tested, just routine, and it dropped down to 21%. And then from there on, it just dropped sort of 0.75% every month. So now it's sitting at 17. So the consultants are saying that you need to see if you can get a live donor. Now, I have got a twin sister. I did ask her, but she declined. But my lovely boyfriend there, I didn't even ask him. He's come forward, and he's getting the workup done. So that's my story. So I'm still on my journey here. So, but yeah, it's okay. I get tired. My memory's not as good as it used to be. But, I'm getting there. I've got a good support network, which is important. But yeah, that's my story.
Hi, I'm Andy. I was diagnosed with IgA informally in 1995 and confirmed in America when I was living over there about 2 years later by biopsy. I recall at the time that I was told I had about a 50-50 chance of having full renal failure. That's just what I remember of that time. And for 20 years thereafter, I had a pretty normal existence and frankly didn't think a great deal about IgA at all. I trooped in every 12 months for an appointment. I was on medication to control my blood pressure. The things that I remember looking back then, early days, were a respiratory disease just used to knock me for 6. I got heavy sweats at night. 24 hours later, there would be blood appearing in my urine, and a couple of days later, I felt washed out, but that was me back up and running again. I felt fine after 2 or 3 days and just put it. I didn't even call the doctors at those stages because I was kind of used to it every couple of years. I think John mentioned earlier, I had low blood pressure anyway, and then to go on lisinopril over that. So I had a couple of situations where I keeled over and passed out when I was doing exercises. But again, I was kind of used to that. And also, I was working. I also we were talking about gout earlier on. One of the useless facts you would need to know is that I now know the Russian word for gout is podagra, because I was working in Kyrgyzstan where I first got diagnosed with gout, and I was hobbling around in Bishkek at minus 20 degrees with no shoes on. So, but I had I wanted, really what I wanted to say is for about 20 years to 2015, I had a completely normal existence. I had a pretty pressurized job working in international development. I traveled to low-income countries all around the world, still on my medication. I ran 2 marathons, I did 8 Great North runs, and was just a typical stupid man trying to compete and being an alpha male. That was my existence. I was working in America in 2015 when there was a diagnosis of a gradual decline in my kidney function for the first time. I was put on a very heavy dose of steroids for about, including the tapering, over a year, which I just found incredibly unpleasant. It was a very difficult time because I was in a stressful job at the same time and not sleeping and putting on weight, and there was a short-term benefit, but as I'll explain in a minute, it didn't work out particularly well. I decided to take early retirement from the World Bank at that stage, and there's been a gradual decline in my kidney function ever since. My current function is 15%. This is my nap time, by the way. I do get very tired, and I'm not able to train as high. I have to keep watch. I'm also tipping around about 6 on my potassium, so I have to watch that, and that means I can't exercise as much as I used to. So the graph that one of the gentlemen showed before lunch is suggesting that I may tip down to the level where I need dialysis sometime around March next year. So I'm looking at dialysis. I have 3 people who I'm eternally grateful for, who are interested in being live donors for me. And they're undergoing the initial process, and one of them presumably will go forward for detailed screening if they decide to go forward with it. So I think I'll stop there. Thank you.
Thanks very much to Andy and Val.